Alright, in this PowerPoint, we're going to talk about the categories of disabilities. We're going to include a lot of definitions for terms of disabilities, and then specifically focus on autism and learning disabilities, as well as cognitive and mental disabilities. Okay, so here we're going to describe some of the different types of special needs terminology. So, autism is a developmental disability significantly affecting verbal and nonverbal communication and social interaction. Autism is the fastest growing serious developmental disability in the United States. About 1 in 110 children, mostly boys, are affected with autism. Some of the characteristics included are communication problems, difficulty relating to people, unusual play with toys and other objects. They have trouble changing routines. They like to follow a very specific structure and routine to their day. Repetitive body movements and or behavior patterns. So there's an autism spectrum, so you can have students who are very severe, and then you can have students who you don't even notice have a disability or autism. So basically, this child can be anywhere on that spectrum and have some of these signs show more or less than others. Deafness, again, is a hearing impairment so severe that the child cannot process linguistic information through hearing. Deaf and blindness means that the child is deaf and blind simultaneously, so they cannot hear and or see. They can't hear or see. A hearing impairment is an impairment in hearing that affects the student's educational performance. So they are not fully deaf, but they have trouble hearing. Mental disabilities are significantly sub-average general intellectual functional, existing concurrently with deficits in adaptive development. So they are far behind intellectually. Multiple disabilities are basically simultaneous impairments in which the combination of those disabilities cause such severe educational programs that they cannot be accommodated in a special education program. Okay, continuing on with our types of disabilities. So orthopedic impairment is a severe orthopedic impairment that adversely affects the child's educational performance. So it's kind of like a physical impairment. Tourette syndrome is a neurological disorder that includes the repetitive involuntary movements or tics. You'll often see them having movements quite frequently that are unexplained. Emotional disturbances include a variety of things. If a student's unable to socialize with others, they have an inability to learn that cannot be explained by any other outside factors. They have inappropriate types of feelings or behaviors. They do inappropriate things in class often, or the way they speak with others. Or if a student has a tendency to develop fears of personnel or like a teacher or school problems. So they're consistently fearing, playing with other kids, or they're fearing their teacher, or a specific teacher for that matter. They could be afraid of the gym teacher. Okay, moving on. Speech or language impairment is basically just a communication disorder that affects the student's educational progress. Traumatic brain injury is an acquired injury to the brain caused by external physical force. So maybe a child was in a car accident, now they have a brain injury. Visual impairments, including blindness, is a visual impairment that even with correction, so even with glasses or assistance, it still affects the child's educational performance. And lastly, pervasive development disorder is a delay in social, language, motor, or cognitive development. Okay, so here we're going to talk specifically about learning disabilities. A few of the characteristics of learning disabilities are that they're primarily normal developing children. They don't often have any visual disability signs. They don't have visual impairments or other of the previous disabilities that we had talked about on the last few slides. They're just normal children. They have a wide range of discrepancies from individual differences. So every student that is affected with a learning disability is affected in different ways. However, these children with learning disabilities are so far different from the norm of their age level and their grade level that they do require some specialized instruction. However, those children with learning disabilities do not require special education funds, so sometimes they do lack in educational support. Some of the signs of learning disabilities include, students who have trouble learning the alphabet or rhyming. They make a lot of mistakes when they're reading aloud, or they might not understand what they had just read. They have a lot of difficulty expressing their feelings when they're writing. or they don't understand when others make jokes. They don't find them funny, or they have a hard time understanding what someone is meaning. And then they also have trouble following directions. You may have to tell them quite a few times or break it down into a few simpler steps than giving them a whole list of directions. It's going to take time for you to break those down so they fully understand them. And those are just a few of the signs, but a lot of children are affected with learning disabilities. Alright, lastly, we're going to talk about cognitive or mental disabilities. In order to diagnose someone, people look at the ability of a person's brain to learn, think, solve problems, and make sense of the world, and then whether the person has the skills he or she needs to live independently. Those are called your adaptive skills, and they're things such as, cooking, bathing, using the bathroom, feeding oneself, communication, social skills, that type of thing, if they're able to do that and live alone. The average IQ score is 100, and those who are classified with mental disabilities or cognitive disabilities score about 70, 75, and oftentimes below that. In more than 614,000 children between 6 and 21 do have mental disabilities that need special education services. So it is important to identify these children and get them the assistance that they need.